My name is Mike Brusca. I'm a lawyer at Davis and Brusca, and our firm focuses almost exclusively on long-term care and institutional claims. Today's topic that we're going to talk about is the differences in long-term care and healthcare facilities, because most people don't have a good understanding of the differences between them, and we're going to talk about that. Here's a roadmap of what we're going to talk about. We're going to talk about what establishes those differences, and then we're going to discuss long-term care and the different components of long-term care, and then we're going to talk about hospitals and the differences in hospitals. I should say that I am a New Jersey and Pennsylvania barred attorney. However, the things we're going to discuss are more or less universal, although state rules will dictate a lot of this, as I'm going to discuss in a minute. So first, we're going to talk about, well, what establishes the differences between long-term care and hospitals? Ultimately, it's going to come down to how the state licenses that institution. So it's going to be important to know what are the regulations, because they're going to be state regulations, not federal regulations. It's also going to be important to know who regulates that particular entity. For example, in New Jersey, the Department of Health will regulate most entities, but who in the Department of Health is charged with issuing those licenses and then inspecting those facilities? And lastly, and most importantly, are the parameters of care. By that, I mean, what level of care is each institution prepared to or expected to deliver? So first, we're going to talk about long-term care. Now, long-term care is often called skilled nursing or skilled nursing facilities, but ultimately it's the same thing. And the universe of long-term care spans the gamut from very little care to a lot of care. So on the one hand, we're going to have independent living. And independent living are apartments. They're usually subsidized by the state, and they provide things like transportation to the supermarket or shopping trips. Generally, those communities have an age restriction that is only people above a certain age. And a lot of times they're also subsidized by Medicaid. On the other hand, you have nursing homes. These are called skilled nursing facilities or also rehabs. And they are the highest level of care that you can deliver outside of a hospital. And in the middle, you have assisted living. And the type of care assisted living is prepared to offer its residents depends. And the regulations are generally very state specific. There are no federal regulations for assisted living. When you look at the continuum of care, you have independent living with the smallest level of care, if any, except for perhaps transportation or some very minor supervision, all the way to skilled nursing, which would be people who have significant cognitive impairment, significant health conditions such that they cannot live independently at home, or even oftentimes with just one family member. So as I said, independent living is more or less little to no care. It is subsidized, and it's generally just assistance with transportation. Now, on the other hand, is the skilled nursing, a nursing home. It is the highest level of care. It will be staffed with nurses and certified nurse aides. It's going to be subsidized primarily by Medicaid, but if they're providing rehab services, by Medicare as well. There will sometimes be state minimum nursing hours they must provide to their residents. The authority for skilled nursing facilities will be a state Department of Health, but they will primarily be enforcing federal rules that are promulgated by the Centers for Medicare and Medicaid Services, or CMS. Nursing homes got to provide a lot of data to the federal government, and you can actually get some of that data, but unlike independent living, which has really no role with the federal government, nursing homes do. And the care in nursing homes is generally uniform based on federal regulations. That is, regulations that apply no matter what state you happen to be in. Since Medicare and Medicaid are the primary sources of money for nursing homes, that they have to follow very specific rules that are set out by Medicare and Medicaid. So the level of care a person receives in New Jersey or Oklahoma or Texas or California is going to be expected to be the same, regardless of where they happen to be. Now, some states provide other regulations or more restrictive regulations on nursing homes given their state rules. However, The federal rules are the minimum standards that they are expected to meet no matter what state they happen to be in. And in between, as I said, is assisted living facilities, or ALFs. And the reality is assisted living facilities can be the Wild West because there are no federal regulations. There are sometimes state regulations, but for example, in my state, they happen to be much more administrative in nature they tend to be much more administrative in nature as opposed to clinical in nature. Many assisted living facilities have no minimum nursing hours they have to provide their residents. There are different types of nurses. There are registered nurses, which are the highest level of nurses that give hands-on care, and there are licensed practical nurses or licensed vocational nurses that have a much more restricted scope of practices. Assisted livings oftentimes will have much higher census of LPNs or LVNs as opposed to a nursing home. Now, this can become a problem. For example, in the state of New Jersey, assisted living facilities are allowed to accept anyone that requires up to and including a nursing home level of care. Unfortunately, in our cases, oftentimes they're not prepared to do that. Now, that's the continuum of long-term care. Now, we're going to talk briefly about hospitals because not all hospitals are the same. And there is a continuum of care for hospitals as well. So as you see on the triangle here, the bottom is hospital, okay? It is a hospital that most people think of. You go there when you're very sick. But there are also these other entities, and some of them are actually quite new. For example, a rehab hospital, which is at the top of my pyramid. And you can see a rehab hospital is primarily focused in rehabilitation services. Even though skilled nursing facilities or nursing homes they can provide the same function, rehab hospitals may oftentimes have a different license. So for example, in New Jersey, a rehab hospital, even though it does the same thing as a skilled nursing facility, will actually have a different license and some different rules. And in the middle there, you see LTAC, long-term acute care hospital, or LTAC. That is an in-between. This is someone who requires more than simply rehab services, but they are dischargeable from a general hospital. And we're going to talk about those differences now. So for example, as I said, with a rehab hospital, it is comprehensive rehab services. That would include physical therapy, occupational therapy, and speech therapy. Oftentimes, rehab hospitals, even though they have a different license, may be located within a greater hospital or on a hospital campus. You may be familiar with that. Then we have the LTAC. These are for people who are acutely ill, perhaps someone who is intubated, and they want to move them from the hospital to a lower level of care, but they are currently sick people. They're generally very medically complex, and the hospital has decided that it wouldn't necessarily be safe to send them to a rehab hospital or a skilled nursing facility because they still require supervision or medical technology that is generally not currently in those types of licensed facilities. They are usually for people who have been in the hospital a long time. These are the sickest of the sick, but they have survived. Usually, at least in my state, for people that were hospitalized over 25 days. And then, of course, you have the hospital. Right? When I was a kid growing up, this would be General Hospital. Everyone remembers where they were when Luke and Laura got married. Okay, this is the highest level of care. It is primarily for diagnosis, treatment, and care, and for care rendered for over 24 hours. This would distinguish it from an urgent care clinic or even an emergency room, right? Emergency rooms are not for people that are going to be treated for 24 hours. People who go to an emergency room for something serious get admitted to the hospital. They don't spend all their time in the emergency room. In fact, oftentimes they just stabilize them and then admit them to the hospital right away. Here's a roadmap of what we discussed. We discussed what establishes the differences. We talked about the continuum of care along long-term care from independent living to assisted living to skilled nursing facilities. And we discussed hospitals, whether they be rehab hospitals or a higher level of care in an LTAC, or of course, the highest level of care, which is the general hospital. Thank you for listening. Have a great day.